everyone. Good morning for those of you on the West Coast, and good afternoon, I guess, for those of you on the East Coast. We are going to get started here with the CFRD Life with CFRD Ask Me Anything panel. My name is Anna. I'm one of the co-chairs and also an adult with CFRD. I will be moderating this session today. With me are my fellow co-chair, Katie Fielding and Sydney Willig. This session is being recorded and will be available after the event on the CF Foundation YouTube channel. You'll be notified by email when session recordings are available. We will be taking audience questions during this session, so we encourage you to submit questions at any time into the Q&A box, and we'll do our best to answer as many questions as possible. Before we begin, I want to remind everyone of our event conduct guidelines. Please be considerate, open-minded, and respectful. We ask that you do not use malicious or offensive speech and do not ask for or give medical advice. If you feel the conduct guidelines were violated, please contact a CF Foundation staff member via direct chat. Let's go ahead and get started. Sydney, would you like to share with us a little bit about your CF and CFRD journey?
Yeah. Hi, I'm Sydney Willig. I'm 22 years old, and I was diagnosed with CF at 2 weeks old. And then when I was 10 years old, I was diagnosed with CF-related diabetes. I instantly started with insulin shots and also a continuous monitor, but more within a year, I just started on an Omnipod insulin pod now.
Cool. Thank you, Sydney. How about you, Katie? Will you introduce yourself?
Yeah. Hey, I'm Katie, the other co-chair. We did not have to have CF diabetes to be a co-chair this year. Just happened to be the case. But I had blood sugar experiences, kind of started in puberty and then continuing into adulthood. And then in my 30s, I moved into that glucose intolerant phase, where it's kind of borderline CF diabetes. And then a couple years ago, after being actually on Trikafta a couple of years, I went into full CF diabetes phase. And so I've been using a Dexcom for the past few years to help me monitor my sugars. And currently, I'm able to manage it just through diet, eating low carb, and through movement. But I'll say that's becoming a bit more challenging every day. Glad to be here with you all.
Cool. Thank you, Katie. As I said, I'm Anna, and I was diagnosed with CFRD about 9. That was one of my first full tune-up kind of type hospital stays. And in the hospital, I think it's probably a routine. They check your blood sugar, and mine was high. So they started the whole process to diagnose me with CFRD. However, what was happening is that I would only have high blood sugar when I was in the hospital. And as soon as I would go home, it would go back to normal. So I always joked I had hospital-related diabetes. But also knowing now, it kind of was more like a medication kind of related and stress issue. However, again, it would go away as soon as I got home. And then we're just kind of monitoring it, just finger sticks now and then. That was about it until I was in my early 20s, and I started needing insulin with all my tube feeds. And that was about the same time I was also getting a lung transplant. And thankfully, the place that I went for my lung transplant was very aware of the fact that many people, not just people with CF, actually develop diabetes from getting a lung transplant due to all the medications that we have to take. So it was kind of on our radar and kind of assumed at that point that that was what was going to happen to me. And it, of course, did. So that was 12 years ago. And I was on shots for a year and then learned about insulin pumps myself. Shots really weren't working for me. And so I asked my endocrinologist about getting an insulin pump and have been on that ever since. So we are going to ask some questions. And again, if you have any questions you want to ask, throw them in that chat. There's a Q&A little tab if you look. It's okay if you do end up accidentally putting them in the chat too. We can get them from there, but try to use that Q&A tab. So our first question is for Sydney. Were you aware that CF-related diabetes could have been a part of having CF? What were you told or not told about CFRD growing up?
I originally, when I was born, we didn't know that CF-related diabetes was even a thing. Growing up, I always had to do the sugary drink test, and I was always on the cusp of being tested for diabetes and actually having it. And finally, the last time I did it, I obviously ended up not passing the test. So the one good thing that came out of that is not having to drink that juice anymore. But I was told when I first got diagnosed that it could just be there temporary and then go away. But the longer I've had it, I don't think it's ever going to go away and that it's always going to be there. So that's been a little bit frustrating, but it was always interesting because I wasn't told much about it growing up.
Thank you for that.
And then our next question is for Anna and Katie. So we were all diagnosed at different ages. What did getting diagnosed with CF-related diabetes look like at the time in your life?
Do you want to start, Katie?
Yeah, sure. So as I said, I was already in my early 40s, probably just 40. And so I'd been on Trikafta for a year or so. And of course, with Trikafta, I had been gaining weight, which was amazing. But that actually led me to having a lot of discussions with my endocrinologist. Like, is this just normal type 2 diabetes or is this CF related diabetes? So he assured me that it was CF related diabetes and the way it was presenting. And it wasn't just because I gained that Trikafta weight. But it is something that is actually, I think, happening in the communities that more people are getting just type 2 as well. So that's interesting. But yeah, so I have CF related diabetes. I was really fortunate to form a nice partnership with my endocrinologist at Johns Hopkins and been able to do it just through eating very low carb and working out. But as I said, it gets harder every day. I really miss rice. And I think after being 39 years before Trikafta of being a eat all you can kind of CF person, um, thinking about transferring to like having to count everything was daunting to me. So I was like, okay, if I can just be and do it with food as long as possible before having to start counting all the things, I would love to do that. But I do miss rice and I think it might be worth counting. What about you, Anna?
I would definitely say it's worth counting. Um, but so I was a little kid when I was diagnosed. And for me, like I said, it was in the hospital that they started noticing that my blood sugars were high. Um, and at the time, I don't know if CGMs were a thing at all or what the story was with that, but they were just testing me with finger sticks, which later I have discovered are so inaccurate and just not helpful because they just tell you what your number is right then in that moment. And like for me, I will go high and then I crash all the time. So finger sticks would say I'm high, and of course I am, but my body will make insulin and then I'll crash. So it wasn't super accurate, but I was diagnosed actually with the glucose tolerance test. So anytime I was in the hospital, my blood sugar would be high. They'd be like, "Oh, you have diabetes. This is going to be a thing of your life now." I'd go home. We'd have an appointment to do the glucose test. I would do the test, and my numbers would be insanely high. Like my doctor told me it was like the highest they had ever seen. But my body would come right back down later. It just took longer than the time of the test. And then we'd be checking my blood sugar again, just with a finger stick after meals, and it was always fine. And that kind of just went on for years. So again, it just really wasn't until as we're checking, my numbers are staying high, especially with tube feeds, that I really was like, I was diagnosed officially at 9, but was really like, okay, you do have it, was like 20.
All right, Anna, how is it different having CFRD now in your 30s than it was, when you were first diagnosed?
So the biggest difference is just like the technology change. Like I said, I didn't have a CGM at first, so we had like no way to really get the data and see what was going on. I when I started insulin in my 20s, I was just on a shot. Um, and then like having the pump has changed everything for me, just because for me, my body responds best to constant insulin than to like a big dose of insulin. So the pump is able to do that. But yeah, really it's technology that has changed. And it's crazy to think that I lived for so long with just a teeny tiny snapshot view of what was going on. All right, we have a question in the Q&A, so I'm gonna jump to some of those. Let's see, where did it go? There we go. Okay, the first one is, what feelings did you have when you were first diagnosed? And that is for all of us. So Sydney, you wanna go first?
Yeah, I remember I was really young, so I didn't understand too much about it. I feel like I was at first had a hard time because I was terrified of needles and blood work. That was my worst nightmare. My mom said I would always run anytime I had to get blood work or anything taken. So trying to then consistently poke my finger with a small needle, that terrified me. So I remember I was super scared at first just because I did not like blood, I did not like needles, and I didn't want to be near any of that. But as times changed, I've obviously gotten used to it. But definitely I was scared and unsure of what was going to happen or what the future was going to look like with it.
I can so relate to you, Sydney. I hated needles too as a kid. And like when I would have to get insulin shots in the hospital, I would literally hide and like lock myself in the bathroom, or I wouldn't eat to like avoid it just because I didn't want the needle. Like had nothing to do with the medicine. I was like, I just don't want that needle touching me. But yeah, so I didn't believe it, of course, because it was just in the hospital. So I was like, that's not a real thing. You guys are just like trying to torture me. And I was a little kid. So there was that too. And of course, I was in the hospital on prednisone. So I was like a little menace, locked in a room, going crazy. But as I got older and it became more of an actual thing, I think I just kind of was like, okay, we're doing this. And on one hand, I feel like there was some relief because it was no longer like a thing that might be coming. It just was like, okay, I have diabetes now.
For me, because I had been in that glucose intolerant rage for so long, I have had a glucose monitor, not a continuous one, but so I had checked my sugars every so often, working with my clinic's nutritionist. We were kind of monitoring things a little bit. And so actually, when I went in for my yearly oral glucose tolerance test, I took my own readings when they took readings. And so I was like, oh, this year's results are a little more elevated. So I'm kind of expecting this result to come in. And then it did. And so, one, I felt relief because once you have a diagnosis, you don't have to drink that drink again. So I'd been doing that for like 30 years. And when you go into those lab places, they most often see someone who looks like, us here on the panel, a young woman. They're like, oh, are you pregnant? And then I just drink the whole drink in one chug because I was so used to it. And they were like, okay, this is a little different. But yeah, so glad I don't have to do the drink again. But also, I would just say annoyed. It was like a foregone conclusion that it would happen. So it's just like, okay, now it's happened. Let's see.
So, Anna, as you mentioned, you are post lung transplant. Can you talk about your experience being post transplant and having CFRD?
Yes. Well, first of all, it was, like I said, it was kind of a known thing for me just because my blood sugar had been a little bit of a problem beforehand. And as a kid on prednisone, it was always a problem. And I was going to be on prednisone. That's one of the meds that you take just forever. So we knew it was going to happen, and of course it did. But mostly I just had like really, really high blood sugars, and it's been a real challenge because since I'm on the medicines, they make you a little bit more insulin resistant than like we as CFers kind of are standard. Not that there's a standard, but with like CFRD, it's a little bit of both. But then with the medicine for transplant, I'm like extra resistant. So that part has been the biggest challenge, and just finding a doctor that really knows how to work with it has been hard. Because if you give me insulin when I'm high, it's not really going to do anything. Like I could give myself 20 units and nothing really happens. But if I give myself insulin like before I get high, I need the teeniest amount and it'll send me super low. So it's definitely been quite a challenge. Let's see.
New definition of getting high. That's right, Katie, in the chat.
I'm going to jump to another Q&A from the chat. So how has access to medication been for you? Have you run into any insurance issues or shortages that make it difficult to get what you need? Do either of you want to take that one?
I've fortunately been lucky. Right now, like I said, I just use a Dexcom to not monitor my blood, but also every kind of year, my endocrinologist is like, your insurance may not approve this because you're actually not on any medications that go along with the monitoring. But so far, my insurance has continued to let me monitor with no issues. So that's been good. What about you, Sydney?
Yeah, I haven't had, luckily, any issues as well. Every once in a while, the pharmacy might have a hard time getting in insulin, but that's just because they're back ordered, but nothing with insurance, luckily. Anna, have you had any issues?
No, I haven't really. I mean, I've had to switch insulin a few times because different insurances will cover different ones. But yeah, I haven't really had too many issues. So, Katie, I have another question for you. You can manage your diabetes through your diet. Can you talk about how you're able to do that?
Yeah, I've been able to do that, I think because I also had like a real regimen of walking every day, like a good 4-mile walk. But I'll say this winter has been the coldest winter since I've been diagnosed. And so walking 4 miles in like a 40-degree day, perfectly fine. But when it's like in the teens, it's not happening. So I'll say the past couple months, my sugars have not been ideal. I've also started traveling a lot more for work, and that makes it more complicated really eating on the go. I have to manage that by like sending or bringing all of my like low carb snacks with me, or I'll send them to the hotel ahead of time. So it just involves a lot of planning. So yeah, I've been really fortunate that my endocrinologist has partnered with me on this plan. That's really important. I really take his recommendations. And so every year we talk about, a pump and insulin. And I think this time when I see him in a couple months, we might have a more serious talk because it does need to be, maybe a little more sustainable than it currently is. Yeah, right. A question for those you guys who have pumps. What was the process like? Katie in the chat wants to know.
Do you want to start, Sydney?
Yeah, I can start. So like I said, I recently just got on a pump. I waited because I just finished 4 years of college soccer, and with activity, my blood sugar drops so quickly. So I didn't really want to be on a pump because I was scared what would happen with my blood sugar and the activity. So the process I had was quite interesting because when I was younger at a children's doctor, they were pushing a pump on me and wanting me to get a pump very early on into my diagnosis, and they weren't really listening to me. So that was difficult. And then when I changed to adult clinic, they were willing to listen to where I was concerned about activity and what I'm going through and how my blood sugar reacts so quickly. Kind of like you, Anna, a little bit of insulin will just drop you right away. And they were like, okay, well, we can start off here. So it was nice having someone walk me through the stages of this is our game plan, but we can change it really quickly. And they have like a call number that you can call 24/7, even on the weekends. So if you're having an issue and need to change, if you get put on a med or something like that and need to change your pump, they can help you and walk you through the process, which has been really nice because never being on a pump and then going on a pump while I was finishing up my soccer, my 4th year, was definitely, I ran into some challenges of how to deal with not going low before a game where I'm going to be running around or going to run. So definitely having someone that supported and listened to me was a big process in getting a pump and going over the different pumps and which one would benefit me better. How about you, Anna?
For me, well, like I mentioned earlier, so getting a pump was actually something that I wanted. And looking back, I like wonder why my doctor never suggested it because it was like they knew about pumps. I had just not, I didn't really know about them. And it wasn't until I like randomly, it's probably on Facebook, saw a post about somebody talking about it. I was like, wait, this is like a thing. Because I knew that if I had like continuous insulin, I was like, that would be like the ideal situation. And then lo and behold, pumps do that. So I like asked my doctor about it and they're like, oh yeah, that would be great for you. We can totally do that. So then it was just a matter of kind of picking out the pump that would be the right option for me and going through that. And then I saw on the question, the person mentioned having to take a class, like a training, and I had to do that as well. So I did that, and it was pretty funny because I was at like the kids endocrinology clinic, and I'm like, at this point, I was probably like 23, 24. So I'm like in this class with these like tiny children that are like, obviously they're with their parents, but it was like, there's me, and then there's like these little like 8 and 9-year-old kids with their little like fun things. But anyways, so I did the class, learned how to use it, and have just kind of been on it ever since, which has been like 12 years, and it has definitely changed the game. So it's definitely something to consider and look into. And I will add that there's a bunch of different kinds of pumps. So if that is something that you are looking into, I would research all those pumps. And like Sydney had said too, you know, figuring out what is going to be the best option for you because they're all quite different.
Sydney, you've had experiences with endocrinologists, some of who weren't really well versed in CFRD and type 2 and the difference between that and like type 1 and type 2. So what has your experience with that been like?
Yeah, definitely. I had a hard time at a children's hospital. I switched over. That was the first I switched over to adult clinic was for endocrinologists. At my child, they swore I would eat in the middle of the night because my blood sugar was spiking, which wasn't the case. I was not eating in the middle of the night, and they didn't believe me whatsoever. So even when I was in the hospital, they're like, "Well, your blood sugar's spiking." And I was like, "Yes, but I haven't eaten anything all day, so I don't know what's causing it." And instead of trying to figure out like what actually was causing it, they were just blaming me for not giving myself insulin correctly and doing something wrong. So I wasn't ever really heard at that type of doctor. And whenever you're in the hospital, I definitely had a hard time finding an endocrinologist who was well versed in CF related diabetes compared to regular diabetes because it's not the same thing. Like Anna said, your blood sugar can react over the littlest things. And like my blood sugar would be 400 because I was on a medicine that would make it spike. And they're like, we have to give you all this insulin. And I was like, no, that's not going to end well. And then I would crash because they didn't listen to me. So that was definitely hard, is finding someone that does understand it. Now being at my adult clinic, they listen to what I have to say. Even more recently, when I was in the hospital, they were more willing to listen to what I was saying, even though we still had butted heads a little bit because they didn't understand CF related diabetes. I hadn't eaten all day. And before my procedure, they wanted me to do insulin. So they thought that was a good idea because they're like, your blood sugar is high. And they think 120 is high. Meanwhile, I'm celebrating that my numbers, like right where it needs to be. So definitely having people not understand that we have a little bit higher numbers and our body reacts differently, because I wasn't eating in the middle of the night and my now doctor figured out it's my treatments that shakes everything in me that makes my blood sugar spike, not me eating. And then we
Bryce in
had
the chat. Oh,
go ahead.
Bryce in the chat wants to know if any of us have used any other diabetes medications.
I have not. However, we have talked about it a little bit. But I have so many different doctors that they all need to be on board, and that just isn't the case right now.
I haven't either, but when I was first diagnosed a few years ago, I saw there were some studies on using GLP-1s for people with CF, and you did have to be currently using insulin to get into those studies. So I couldn't pursue that, but I'm hoping maybe there's some results on that now, so that maybe as I'm looking at medications in a few months with my doctor, maybe that's part of a discussion.
I have only ever been on insulin and nothing else, so I have not either. Anna, what do you wish the post-transplant doctors knew about CF-related diabetes?
The biggest thing is just how specialized it is, and how like we really need to be working with a specialized endocrinologist. Thankfully, my team is pretty good about it, and like they know it's a real thing and they're pretty used to it because there's a lot of other CFers at the center that I go to. And actually, when I'm inpatient, the team is really like the endocrinology team is really good. It's the outpatient team that just I mean, the last time I saw them was 6 years ago, so I don't know for sure. It could have changed. But the outpatient team didn't have anyone who specialized in CFRD. Um, but thankfully, my doctors are open to kind of me dealing with that on my own. So I just see and I live in the Bay Area, but I go to Colorado for my endocrinology because I didn't want to switch. I'm from Colorado. And that's where my endocrinologist that is good and knows what's going on lives. So I just stick with her. So another Q&A from the chat is, any tips for managing site rotations when you bruise very easily? I'm on prednisone too. I can take that since I'm on prednisone as well. I really just try to use different spots as much as possible. But it can be hard because I have certain spots that are good and certain spots that are not. So like for my pump, for instance, I actually use different of the different little inserts because I'm on a tandem. So I have just like the little thing that sits on your skin and then it connects to the pump. And so I actually have some inserts that are the straight ones and I have some that are the like at a little bit of an angle so that I can use them in different spots. And then I also have short tubes and long tubes so that I can put them on my arms sometimes and like really rotate as much as I can. Sydney, do you have any tips for that?
I do bruise easily too. For my pumps, I can only use my arms. With how active I am with running, they won't stay on my legs. So I can only use my arms for my pumps. And the only thing that I try to do is do the back of my arms, just because that seems to be the least avoided area that I run into everything. It's the least avoided area I can run into unless I'm like backing up and just completely not paying attention. But that's the one spot is I try to make it where I won't run into something, because I'm known for ripping off my CGMs and Dexcoms because I just run into everything.
And then Katie, can you walk? Oh, yeah, no, we didn't do that. Can you walk us through what it looks like being diagnosed in endocrinology?
Yeah. So, like I said, for me, I'd been in that indeterminate range for quite a while. So, I was working pretty closely with my dietitian in my clinic and making sure that, and she was kind of monitoring things with me. We were starting to, use a Dexcom for a few weeks to get a better picture. While I was in that like indeterminate range, I participated in several diabetic studies. looking at actually how to find some of the best testing to determine if we have CFRD. Like, is the drink and the 2-hour test good? Or do we need to do like a mixed meal? Or so I did some cool like testing along the way. But then finally we got to using CGMs for kind of a diagnostic purpose. And so I wore one and working with, in my clinic. And she was like, yeah, I think it's time that you go see the endocrinologist. And then my OGTT that year really told me I needed to. But so when I started to go to him, okay, first of all, I did not know when you go to the endocrinologist that they look at your feet. I had no idea, okay? So I come home and it was winter, my feet were not prepared. I came home from the endocrinologist and I told my partner, who is a normie, he's not a sick person. I was like, "Oh my gosh, they look at your feet like and do a whole thing with the feet." And he was like, "Oh yeah, you didn't know that?" And I was like, "How do you know this?" Anyway, so if you're going to start going to an endocrinologist, they look at your feet. It's for neuropathy to see the sensitivity and the movement and all those things. So just be aware of that. But yeah, going to an endocrinologist is great. They do usually at my appointments, they take your A1C right there in the clinic and find that out to see where you're currently standing. They take your data from your CGM from your Dexcom and they look at all that. And then you have the appointment and, you just have your conversation with your doctor and talk about the data. At least I do. I'm really data driven person. So we talk about that. Actually, he even said one time, he's like, "You really like data, don't you?" And I was like, "Yes." Um, Anyway, is this an autism diagnosis too? I don't know. Like, but anyway, um, he, so we talk about the data, see where I am, and so it's just a good conversation, a good relationship to build. So maybe even when you're in that indeterminate zone, because we've talked a little bit about how hard it is to find a good endocrinologist with CF. So if your clinic has one, maybe like start seeing them if you're in that indeterminate range, like once every couple of years or so to just start that relationship, I think can be helpful because that is actually what I did. I started seeing him when I was still in that range every couple of years before I started seeing him more frequently. The feet check, yeah. Something. All right, we have a question from the chat. Someone says, "Has anyone tried the Bionics ILET? I think it uses AI to learn your patterns and anticipate your insulin needs, so you don't have to count carbs." From Mark. But no, now that you've told me this, I just said I'm a data girl. I'm obviously going to go look into this if I'm going to my doctor in a couple months. Anyone? Anna, Sydney?
I have not tried it yet. But my endocrinologist is a huge fan of it, and I honestly think she tries to put all of us that she sees on it. But I am not currently eligible for a new pump, so I'm not on it. I think I have like a year, and then I can decide.
I've never even heard of it, if I'm being
Oh, did we lose Sydney?
the
Oh, we did lose her.
We can sort of hear you, but you disappeared. Maybe she'll be back.
Yeah, I hope so. She's
Oh, there we go.
back.
Yes, I go to the diabetes doctor in like a month, so hopefully I can ask then and figure it out.
Cool. Sydney, you were recently in the hospital and had some experiences with some diets when you were in the hospital. You want to talk about that?
Yeah, so whenever I go into the hospital, I always make sure to tell them I need the CF related diabetes diet because it does the carb count for you, which makes it a lot easier because sometimes by the time the food comes up, I'm not as hungry as when I ordered. So then I can just cut out what I don't want and subtract it from the carbs. But it also allows you to get the extra food for the CF diet while not being limited to a regular diabetes diet that limits how many carbs you're allowed to have per meal. So that's something that I wish someone would have told me when I was first diagnosed that you could do because as a CFer when I was first diagnosed, like I was always still hungry because they're like eat a diabetes diet, but you also need to have the CF fat. So that was something that I wish someone would have said younger, but now that I know, I make sure that I advocate to have that every time.
Sydney, you just talked about counting, and the next actual question from the chat is all about counting. So they want to know, what does that mean?
Counting means counting how many carbs are within your meals and how many sugars and proteins, to help figure out how much insulin exactly you need to figure out to do. And it's nice because, at least for my Omnipod, I can put in the carbs and it does all the calculations for me now. So I don't have to think about all the division I used to have to do when I didn't have an insulin pump.
And
Anna,
so
is that how your pump too?
how long before you eat do you have to do this counting?
I usually try to do it about 20 minutes to 30 minutes beforehand. I am a very picky eater, so that saves me sometimes because I usually know generally about what my carb count normally is per meal, since I am a picky eater and eat the same exact thing every time.
And see, I'm not, and that's why I've been avoiding the counting.
Yeah.
I just want to eat on the fly. I just don't.
I'm terrible at pre-dosing my insulin. So I often will give it and then like kind of just eat right away. And it works okay. It's best if I can give it early. But yeah, I like you, Katie. I'm like, I just want to eat everything. And I so often I'll like be like, I'm gonna eat this. And then I'm like, actually I'm gonna eat this too. And so like my doctor and I, we figured out that counting like only works for me to some extent because I always end up eating more. So now I count what I'm going to eat and then I add like 40 grams more of carbs because we just know it's just going to happen. And that has worked really well.
Yeah, mine's generally around 70 every time, so I can usually just keep 70 in my pump, and it's pretty accurate every time, which is very helpful for me for like main meals.
I see a quick question that goes with this popped up. It says, how do you count calories/sugars if you're going out to dinner or eating at a friend's house? Part of the like training for having a pump, and even I think I did this before just with giving insulin, was about learning how to count carbs. And so they'll kind of give you like a sheet that has like this has this much, this has this much. And so you kind of get good at just being able to guesstimate based on what you're eating. So like when I always know, I don't know why, because I really don't drink milk that much, but like that one has really stuck with me, is like a cup of milk's like 12 grams of carbs. But you just know that. So you can look and be like, okay, I'm eating, about a cup of rice. Oh, it's 45 grams. So you just kind of know. And obviously it's not perfect. You're not going to know every little thing that went into a dish, but you can kind of get there. And at least for me, I don't know if it's the same for you guys, but like with counting, there's certain things I don't count at all. So like veggies that are very low carb, I just don't even bother. Like those few carbs aren't going to make a difference. Or like sauces, like a salad dressing, I'm not going to count. If it's like really sugary, like honey, I might count it, but most I just don't. That kind of thing. And it works out. And then of course, with technology these days, you can kind of Google stuff. So.
I was going to say, a lot of the restaurants like have on their websites the calorie counts and carb counts and everything. So you can always go to that website, even if you just type in, like, I know I go to Dunkin' at the end of every week to get a drink, but I always can just go to the Dunkin' website, find my drink, and they have the calories and carbs and everything there. So you don't even have to think about it. So that's the one nice thing too. Like I said, being a picky eaters, I get the same thing every time. So I can kind of just put it into my notes section and I have that area there. And like there's some apps that you can be like, okay, I'm going to this restaurant. And then you can add in your meal and it does it all for you, which is super nice.
Is there an app yet where you can just snap a picture?
No, there should be.
I feel like AI can help us with this.
Yeah, I'm waiting for that.
So am I. I'm waiting for that.
We need that. That's a good use.
On it.
That's a good use for AI.
Someone in the chat says yes, there is.
What?
Okay, we need the name. We need the name of that app, please. Yes. All right. Here's another question. About the sites. Have any of you guys used off-label sites? And like the Dexcom, for instance, says like I can put it on my love handles or my butt, basically, or is not a labeled site. Like it says you can put it on your arms, but some people, like if you're a little kid, you can put it on your butt. So some adults, I think, do that too. Um, and so someone says sometimes I feel like I don't have enough fat on my arms or too many bruises on my arms. I don't have any experience with off-label sites. I've always just done it on my arms, but I'm also not using a pump, so I just really have the Dexcom to worry about. So
I get very creative with site placements and have used some off-label sites. I also will say, like, for your arms, like, for at least the Dexcom, I honestly don't know that it really, like, needs fat. Like, maybe it does, but I've noticed mine works fine, or at least I'm, like, used to the range that I need to be in on the Dexcom versus, like, with a finger stick, because they can sometimes be a little bit different, just based on, like, where like, what it usually is. Because I, like, don't have any fat on my arms, but it's fine. So, that might be fine too. But, yeah, I often use, like, my upper butt area. That's one of my favorite spots.
I use my hips usually or like around my stomach for my Dexcom usually. Um, the hard part with that is like when you wear jeans or dress pants. I always run into the issue of if it's a high rise, sometimes my monitor's then rubbing. So I try to buy a lot of clothes low rise so I don't have to deal with that. But I usually have a lot of good monitor and blood sugar reads there. And then another question is we've all had to advocate for ourselves with CF generally and sometimes with CFRD. What advice do you have for others with CFRD? Katie, do you want to start off?
yeah, I think, just kind of I've said it already. It's just like have insight, kind of form that relationship and find the endocrinologist that's like good for you and knows CFRD. Um, and try and like if you're in that indeterminate range, start now, building that relationship. That way, when you get to that point where you need to have like the harder discussions or the more, technical discussions, you already have like established that relationship with that person. What about you, Anna?
Um, yeah, I've definitely had times where I have had issues. One of the biggest things I actually learned is that if you are in the hospital, you can request to be transferred to a different hospital. Which it's a very long story, but I was stuck in a hospital with a doctor who was trying to fix my diabetes, who had no business fixing my diabetes. And it took me a week before I realized that I could switch out. I was like not at my normal hospital. Um, and so I had to it was really hard to, like, advocate to get switched, and it took, like, talking with my other doctor and all kinds of things, but we got switched. So, I mean, that is something huge to just know is, like, you can request someone else to look at your case, you can request to be switched to a different hospital, that kind of thing is super important to be able to do and to know if you need to do that, do it. Let's see. Um, did any of you have any symptoms when you were diagnosed, or were you only diagnosed by your blood sugars?
I mean, I was probably peeing at night a lot and a dry mouth. Yeah.
I honestly don't remember if I had any symptoms because I was so young. Um, so not that I can think of off the top of my head, but Anna, did you have any?
No, because like I said, I was diagnosed kind of before it was even really an issue. So I didn't have any real symptoms. Now, however, I mean, there are real symptoms of low and high sugar. So, like, if you aren't diagnosed and you're having symptoms, like, definitely that's something to look into. because like if I have high blood sugar, I feel super tired, my head hurts, I like often will feel kind of sick and just really thirsty, peeing a lot, don't want to eat. And then of course, low blood sugar. Okay, I take it back. As I'm saying all this, I'm realizing, yes, I did have symptoms. I had symptoms of low blood sugar. So before I was diagnosed and even after I was diagnosed, before I needed insulin, I had issues with low blood sugar all the time. So with that, I would get like super dizzy and be like completely starving, but only for sugar. Like I didn't want to eat anything, but like I would eat every piece of sugar, any juice, any candy I could get my hands on. And I always describe it like I feel like I'm turned into jelly. I just like can't possibly function any longer. So I did have that a lot.
Another question in the Q&A session, Katie, I feel like this is more towards you, is someone said that they're close to having CFRD, their last glucose test, which was 199, where it was like they're diabetic. How has your diet had to change since your official diagnosis? Is it very hard?
Yeah. A 199, that doesn't seem that bad. Like,
I'll
oh,
take that number right now.
I'm sorry, initial reaction. Um, but yeah, I mean, I eat very low carb. So I eat very high protein, which also I'm a woman in like my early 40s is supposed to be something I'm supposed to be focusing on in my diet as well, just like as an aging woman. But I eat very high protein and very low carb. And so I eat like a lot of vegetables, and like try to also eat high fiber because I'm aging. And also that's just good for you. But yeah, I will say it's another thing that's aspects of hard that maybe doesn't talked about a lot is eating like this is very expensive. So that if you're eating like high protein, low carb, it is a expensive diet. So expensive, in fact, I'm actually currently quarterly called by the Census Bureau. I got on their consumer price indexing survey for this year. And so there's just two of us in our house. And when I told him, prices of they go through all these categories and what are you spending? And so I'm like, oh, this is like, what is your rent? You tell him, and he's like, oh, you have a great rent, and yada yada. And then I get to my grocery bill, and he's like, I'm sorry, what? And he's like, I was like, yeah, that's it. That's the grocery bill. And I was like, I am diabetic and I eat low carb and high protein, and that's how much it costs to eat like this in America. So I will say, like, it's a privilege that I can choose food in this avenue. You don't get a copay assistance for your grocery bill. Um, so yeah, that's definitely something to consider. It'd probably be cheaper for me to just go on insulin and have my insurance pay for that and be able to just add a lot of, rice and bread to my diet. That's a lot cheaper to buy.
Anna, have you had to change your diet at all?
No. Well, okay, that's like sort of true, sort of not true. I So depending on the doctors you're talking to, they're going to give you different answers. So like I said, like I at first worked a lot with the like general endocrinology team when I started on insulin full time, and they're like, oh, you have to be super regimented, like eat your breakfast at this time, eat your lunch at this time, eat your dinner at this time, eat this much, like that kind of thing. And that just does not work for me. I have way too many years of having CF and eating whatever I want to really do that. And for me, food is like one of my favorite things in life. And so I a little bit refuse to really adapt that. I'm like, you lose so much with this disease, but I'm like, I'm not losing that. So I refuse to change my diet. However, I will try to eat a little bit lower carb just because I know even with insulin, it's better not to like just be eating like gummy bears all day, every day. So I try to pick like better things that are lower carb and a little bit healthier. But as far as like changing my diet specifically for diabetes. I really don't. I just manage it with insulin as best I can. What about you, Sydney?
Yeah, I think the thing that helps me is I don't like bread or anything like that. Katie's like, how? I'm not a big bread person. I don't like things like that. So I think that really has helped me. And I'm not a big candy person other than like gummy bears. That's a great low snack that is my favorite. But I'm not a big candy person, so I also think that helps me too. Um, my diet has always been based on working out so much. So with soccer and running, I always try to do like before big games and then before a big run, we always do like a carb dash thing with pasta and everything. And so then I'll get a little bit of extra calories and carbs that I have to treat for. But other than that, I usually just stick to like grilled chicken, and I can't really eat seasoning either because my stomach's so sensitive. So I think I kind of luck out that most of the stuff I eat, I'm usually okay with.
Katie, this was one for you. How long were you in the glucose intolerant range before your official diagnosis?
Yeah, it was like 10 years.
Oh, wow.
It
Yeah.
was a long time. Yeah. It was a long time. And kind of like you had talked about, there were times in like my teens and 20s when I would go in the hospital and have to use insulin because of medication. But then outside I'd be just jolly and fine. Yeah.
Mhm.
Yeah. But yeah, 10 years, like my whole 30s basically was the intolerant zone.
Another question for everyone. Have any of you had experience with severe hyperglycemia emergency that required glucagon treatment at home?
No, but maybe.
I can say yes recently, actually in August. And it was in the middle of the night, right after my poor mother. Right after I moved in alone by myself for the first time, I was extremely low after a long run. I was sleeping, and I ended up having a diabetic seizure at my apartment by myself for the first time and had no clue that I had it. And I woke up, it was probably the third week that I started my job. And I was like, Mom, like I missed my first day of work. And she's like, you're talking nonsense. I think it was like 3 a.m. in the morning. And I called her crying that I had missed my first week of work. And she's like, what are you talking about? And then I called and FaceTime her, and I looked like a disaster. She's like, what happened to you? And I go, what are you talking about? I had like blood and everything all over me. But that was because I was up trying to treat, and I don't remember any of it, and fell through a wall, my door actually, in my apartment, and while I was treating. But now I've been told that I can use my emergency pen before I go too low, which is a good thing to know because after long runs, my body does react throughout the day of going extremely low. So I have had to use a pen a few times because I've had other low blood sugar seizures in the past too.
That's so scary.
Yeah.
I haven't ever been that low or like I had a seizure, but I have definitely been really, really low. And I just am really stubborn. And so I'm like, oh, I'm fine. I got this. And I probably should have been using glucagon, but didn't. And there's definitely been times where I'm so I always like when I get low blood sugar, I get really, really hot and sweaty. And so a lot of times I'll like take my clothes off. And so I'll just be like lying there in my underwear on the floor with like candy on my chest, just like eating it like a crazy person and like kind of out of it, kind of not. So, I mean, that's definitely a spot where I should be using glucagon, but just don't. And I don't know why really. But yeah, I that also kind of relates to another question, just about living alone and how you guys handle, like, especially Sydney, because you're like completely on your own, or Katie, if there's been times you've been on your own, just like how you handle that being on your own, because it can kind of be a little bit dangerous sometimes.
Yeah.
Yeah. I do have a partner I live with, but I do travel for work alone. So I just always make sure that I have sugary snacks in my hotel room and like good snacks so that if I do have a low, like I don't have to leave that hotel space to get something to help at that time.
Mhm.
Yeah, in my apartment, I have stuff now spread out everywhere. So no matter where I am, if it's in bed, like next to getting ready in my living room, I always have stuff spread out now to make sure. I also will usually call someone so that they're on the phone with me. I usually try to do FaceTime if I can so that they can visibly see me because obviously I could keep talking if I'm low. But I want them to be able to physically see like how I'm reacting and how I'm doing. My mom makes me send her pictures still of my blood sugar to prove that it's going somewhere because sometimes my Dexcom will say I'm still dropping while meanwhile my finger's like, okay, you've caught your blood sugar. So definitely being on the phone with someone and having stuff spread out is really important.
Oh, and my partner, I let him follow my Dexcom also. And so that's really nice.
Yeah, I kind of do the same thing as both of you. Um, Definitely, yeah. With traveling, especially, I always like that's my first thing I do when I get somewhere is like go get some juice and stuff. So I have things. I also I always try to bring candy or something with me in my bag too. And then yeah, when I used to live alone, and whenever I'm like completely alone, um, I like you, Sydney. I call my mom usually and just chat with her. Well, not even really chat because I don't know what's going on, but have her on the phone so she can make sure I'm still responding. And she knows she's like, okay, if you stop responding, like call 911 right away. That helps for
My
sure.
colleagues have already, because they travel and we go to a lot of work conferences, they've already cut on that I'm the pharmacist and I have snacks. Like they know that they can ask me, do you have like a Tylenol or a NyQuil? Like I just have everything I might need.
Yeah,
Uh,
yeah. The snack person, that's a good person to be.
I know.
Snacks are always good.
All right, here's a question. My favorite CFRD tip and trick is Diet Coke. That is what keeps me sane. What are your favorite tips and tricks for living with CFRD?
I can go first. My favorite tip and trick is I guess this is kind of helpful for, like I said, for me, for being a picky eater, is kind of staying in routine of something. Like throughout the week, I do like to cook a lot at home just because then I can manage what I know is being put in. But I usually keep the same meals every week. I'll rotate what day it is, but I try to keep consistent with that just because it makes my life easier. And I know how my body usually responds to that. And always for me, knowing that I'm going to go work out, that day I need to eat more and cut my insulin off early on in the day and keep it off hours after because my blood sugar, even though I've stopped working out maybe now 3 hours ago, my blood sugar will still drop because I did work out sometime throughout the day. So just being aware of that is something that I am aware of. And I know other people with CF diabetes too that I've talked to have that same issue.
For me, I mean, so I cannot do diet drinks at all. They like make me so sick. I like get a headache and feel super nauseous, but I'm like always drinking water. So like that is a good method because, there's no carbs in water, so you can have as much as you want. I also for going low, I become a crazy person and eat everything in sight. So I try to like usually I do like juice boxes a lot. That's really easy and helpful for me because they're portioned out, but I also will like portion out things. So, like, one of my favorite things to eat when I'm low is marshmallows. So, I buy like the big bag and then I keep little tiny Ziploc bags and I put a serving in them. So that way I don't eat the whole bag because I will. Um, and I think another big tip for me is if you can, like, talk to your doctor and get a CGM because that is has been the most helpful thing that I have had is to just know and learn what is happening with my body, because our bodies are so weird and do weird things. And having all that information is so helpful to be like, oh, this is what happens. Like that's how we figured out that like, oh, I'm eating way more carbs than I think I am at dinner because I eat food and then I eat more food. And like we wouldn't have realized that because I do it and don't realize I'm doing it without my CGM, because I like have a spike and then I'll have another spike and it's like, oh, that's what's going on. So I think that is a huge tool if you can get your hands on that. I highly, highly, highly recommend it.
Another question is, what do you wish you had known about CF-related diabetes when you were first diagnosed? Anna, do you want to start off?
Yeah, so it's a little hard because I was so little when I was diagnosed. But I definitely think it would have been helpful if my doctor had talked with me more about how CF diabetes is weird and that it's perfectly normal for my blood sugars to be crazy high in the hospital and perfectly normal and good at home. But honestly, I don't know that my doctor knew that. So it's like I think there's just been so much progress that's been made over the years that it just really changed. And also I think knowing about my options of like insulin methods earlier would have been good. Just knowing like I could have been on a pump when I started insulin would have been really helpful.
How about you, Katie?
Just the feet thing, honestly, like no. I guess I guess similar to what Anna said, the complications, that it's just not a straightforward thing. And for instance, like my mom is type 2, and so she sometimes doesn't, because I was adult, she wasn't managing my CF diabetes. So she wasn't like, I wasn't a kid when I got it, right? So she doesn't have the day to day with it. But sometimes she'll ask me things that are like very type 2. And I'm like, no, that's just not really the experience over here. And so it's just, I'm almost like selective with who I mention the diabetes to, because it's just like, I don't need this to be a whole conversation of like how this is like or not like what other people are experiencing. What about you?
Yeah, I definitely think it was being educated a little bit better on what it is going to look like, because being told that it could go away, I was very excited and always like, oh, is it going to go away this year? Is it going to go away this year? And to realize it's actually probably never going to go away. That I wish someone would have like looked into that a little bit more and not given me hope when I was like 9 years old, saying, "Oh, this could happen." And now here I am at 22, like, no, you're deep into it. This isn't ever leaving your life.
Your pancreas said no. It's
Yes,
done. It's just done. Sorry.
Quit.
it quit. It quit early on.
Yeah.
I know Katie, you've mentioned it a little bit, but can you go more into like your experience with modulators? And then also Sydney, are you on modulators and has that changed your CFRD at all?
Yeah. So I guess I've been on modulators, 10 years plus, 12 years almost, I guess, now at this point. I think it started in 2015. Yeah. Um, yeah. So I was intolerant already when I started modulators at that point, or just kind of gotten to that point of being intolerant. And then, like I said, a couple years into Trikafta, I don't know. I don't think there's much connection, except maybe the weight I gained kind of pushed me over, maybe. Um, there was more body to manage for the pancreas, I guess. I don't know. But yeah, it doesn't really, I don't think it's in so far, like I've heard from other people, like it helped their diabetes. Like I don't think it's helping mine. So that's my verdict, at least. What about you guys?
Yeah, for me, I was on Trikafta right when it got approved because I was super sick at that time. Um, I didn't really notice anything different with my blood sugar. I'm now on a lift track. I changed that in July, I believe, and I haven't noticed any difference with my blood sugar on that either. And I have heard that people have had better blood sugars with it, but unfortunately not for me. I have not noticed any difference. Anna?
So I have tried both, and I did actually notice a benefit with my blood sugar, but unfortunately, I have really horrible side effects, so I've had to stop. So I'm not on either. Let's see. Katie, there's a question in the chat for you. As someone managing CFRD through diet, do you have any ideas for managing food? So this person said that they eat a salad or a high fiber vegetable at
Yeah.
the beginning of each meal and it blunts the glucose spike. Do you have any other ideas?
Yeah, no, that totally works. And I do that all the time. Like I'll eat vegetable, like the order you eat your food does help the spike from happening. Or if I do want like a little sweet treat, I will pair it with like a meat stick. So like that like protein will prevent that like bump like spike from super happening. But yeah,
Nice.
always pairing if I do want something with a little more carb, making sure I have protein with it has been definitely a strategy that's helped me the past 4 years. And for instance, I really wanted pho last week.
Right.
And yeah, those rice noodles will kill me. But I was meeting my friend and I drank one of those Fairlife 42-gram protein shakes on my drive there. And so, because it was like 40 minutes where my friend lives, and it did not spike. I ate the whole bowl of like rice noodles. And so that definitely is a strategy to like, if you're gonna have that carb, like have protein before it. And then like if you are gonna eat like doing what they said, the fiber vegetables before at the beginning of a meal also helps too. But yeah, always pairing a sweet treat or high carb thing with some protein can definitely help.
That's impressive because, yeah, pho like raised my blood sugar so much.
I know,
But
usually
it's
yeah,
so good.
I know. Yeah, it's definitely I was like, "Oh, let's test this out." And it only went to, like, 220, and I
Nice.
was so impressed. I was like, "Okay, like, we're not in 300."
I like how CFRD is just like its own animal. Like the numbers our blood sugar can be, and we're like, that's great.
That's
Like
fine.
most people with diabetes are like, what? Like they're just horrified by it.
I
I
know,
had a
I have
friend
friends
in
that
college. Yeah,
go
and
ahead,
she
yeah.
had diabetes. And she was like, what are you doing?
I had nursing majors on my soccer team, and they're like, "Oh, what's your blood sugar right now?" Like before we would start practice, I'm like, "Oh, 200," and they're like, "What?" I'm like, "No, this is really good going into practice." And like halfway through practice, not even I'd be low. They're like, "How? How did you manage that?" I go, "Exactly. That's why I said it was so good because I made it at least 30
Yeah,
minutes."
yeah, right. It's so funny.
And I wanna know, not just from you guys, but I wanna know from everyone in the chat, what is your go-to low treat? What are you going for when you like, now I live for a low? Not really, but, like, when it happens, I'm so excited. I'm like, "Yes," because I eat low carb to manage it. Like, I'm like, I do get that sweet treat, and for me, it is Swedish Fish or
Mm,
Sour Patch Kids. What about you guys?
definitely gummy bears or marshmallows. I mean, I usually, like I said, I usually go to juice because it's easy. But if I like really am excited to get to eat something like a crazy person, it's gummy bears or marshmallows. But I have to separate them out or I will eat the entire bag.
Oh, the red dye was making her break out? Oh,
I saw that.
Oh,
This
crazy.
this is gonna be crazy, but when I'm home, gummy bears. When I'm running, my friends that I run with judge me for this. Cold gushers. I don't
Mm,
like
okay,
them warm. I like them cold because I don't like the juice in my mouth. So
okay.
cold gushers or Sour Patch Kids are my go-to running low snacks or working out low snacks.
why a difference? Any particular reason? Or just
I feel like my body handles the extra sugar better when I'm running compared to gummy bears that it takes a decent amount of them to get me back up.
Mm.
So if I have a little bit of a difference, I think it helps my body a little bit more.
interesting. Yeah.
So I actually have a CF related reason for why I love Sour Patch Kids. You guys use the Toby Podhaler?
Mhm.
Did you ever have to do tobramycin nebulizers?
Yes.
Okay, you did. Okay. I didn't know if you were too young that you never got to have that wonderful experience, but they were horrible tasting. And the first time I was like 10 that I had to do them, you had to do it at the hospital with the doctor for some reason. I don't know why. But he told me to suck on sour candy and like had some the first time I did tobramycin. And so like, can you imagine your doctor telling you to just suck on candy when you're doing it? But he did. And then that's my Sour Patch or Kids origin story right there.
Nice. Okay, does it work? Like, does it
Yeah,
make it
yeah,
taste
it
better?
worked. Yeah.
Oh, wow. Because
Yeah.
I'm still doing tobramycin inhaler or,
Oh,
like, the Nebbies. Yeah.
really? Oh my god.
Yeah. It's because it's through my transplant doctor, and they're not with the CF Times.
Oh, I had to do it so far back in the day where I had to mix the powder
Oh
with
my gosh, yeah.
the
I,
saline.
like,
Anyone else in the
vaguely
chat have to do
remember
that?
doing that,
Yeah.
but
This is the old school. You had to
yeah.
use a syringe, a needle, powder. It was
Yeah,
a whole fun thing.
that's funny. I'm gonna try it next month.
Yes, do it, do it. All right, we only have a few more minutes.
I like that a lot of people in the chat are saying marshmallows and, gummy bears, Sour Patch Kids. Those are all
If
And
anyone hasn't yet had squashies, I would totally recommend this candy. It is like a mix of a gummy and a marshmallow.
what? I have not heard of this.
It's gonna be your new addiction. You can
where
get
do
them
you
at
get these at?
I'm gonna
Target.
start trying to get Lowe's just so I can eat them.
They're so
No,
good.
I'm not gonna do that, I will say on camera.
They're very good. I
Yeah,
recommend.
but I will eat them. That sounds so good.
Another question is, what food makes you go high that you wouldn't expect? Anna, do you want to start off?
Trying to think of stuff. There's definitely food that does it, or, like, way higher than I should be, but I can't think of it off the top of my head.
Katie, do you have any that you can think of?
No, not right off my head. Um
I saw someone mention pizza. That
Oh.
one is a weird food for sure. My doctor was telling me one time, she's like, "Oh, your blood sugar kind of follows the shape of the word, so it, like, goes up, it's like pizza, and stays high for longer."
Oh, what a trick.
Yeah.
I would have to agree with the corn conversation that I'm seeing in the chat. I was not sure that corn would send me that high, but it does spike me.
I feel like everything. I, like, look at food and my blood sugar's like, "I'm gonna go really high now."
Even if I think about it, it's
Yeah,
just gonna start going up.
yep. Yeah, I can't think of anything off the top of my head, but
Yeah, I can't either.
there's definitely food. Well, I think we're right about at time. So we just want to thank you all for coming and joining our panel. And thank you, Katie and Sydney, for spending time here and sharing with everyone. We have a survey in the poll tab for you all to fill out. And that will be it for now. We have some other sessions coming up, so we hope you guys join them and have a good day today. We will see you in the next thing.